there seems to be a widespread belief, almost assumption from a lot of people, and there's a lot in the public, that there are environmental things causing breast cancer. We get these questions all the time, whether it's ubiquitous plastics, hormones in meat, chemicals in food, chemicals everywhere. Is there any evidence for any of this, for any role for chemicals? I know it's a tough question, but people are absolutely convinced of it, and I think there's a lot of energy and stress and frustration that goes into people worrying about this. People use it, I mean, they wind up having phobias about products they have in the house, and an awful lot of women who wind up with breast cancer, cell phones, I say, people who wind up with breast cancer wind up wondering if they somehow brought it on themselves by lifestyle. Does anybody dare to take this on? Dr. Davidson, lead forward. I hope that meant you're going to...
Dr. Esserman there. I'll take a tackle at it. She's from California, so she'll be able to really talk about this. This is such a controversial question, and it's one that I think we all worry about terribly. There's no question about it. But my own read on this is that at least right now, I don't see any credible information to suggest that these kinds of things are really associated with breast cancer risk. There are a lot of things that are, and we talked about it today. We talked about postmenopausal obesity. We talked about alcohol, which pains me greatly, but which I think is true. So I think that there are, and we talked about hormone replacement therapy for long periods of time. So I think that there are some things that we could view as environmental, right, or environment as our bodies, that are pretty clearly associated with breast cancer and where we have control over it. I just don't think that we have good knowledge about the rest of it, and so I certainly counsel patients who come in and are worried terribly about this, that first of all, I don't think there's anything that you did that made this happen. Very important to know. I don't think there's anything much you could have done to prevent this at this point. And I sure wouldn't spend a lot of time worrying about some kind of exposures in your environment. I would really focus on the things that are under your control and getting the appropriate treatment.
So Nancy, I think you should move to California. That was a great answer. I think that, again, I think part of what makes it so difficult to study is, again, for a lot of screening, prevention, and environmental risk, we treat breast cancer as if it's one thing. But I think you've heard this morning that breast cancer is made up of 3, 8, or maybe 12 different diseases. And I think the more we understand those specific kinds of cancers, then I think we may be able to do a better job of understanding which environmental exposures may be at play for certain kinds of cancers. But I think for what we know today, I would agree with Nancy that the primary thing that we do know that we can control is that the internal environment does make a difference. And we should focus on the things that do matter. Keeping your alcohol intake to 3 to 5 glasses of wine a week, trying to really keep your body mass index or your weight in a normal range, and exercise, and avoiding combined hormone replacement therapy if you're postmenopausal. Those are things that we know today can affect your risk for breast cancer.